Yes, any healthcare provider with a valid DEA registration number can prescribe Suboxone. Basically, if a healthcare provider wants to write prescriptions for controlled substances, they need to register with the DEA. Up until last year, providers needed a DEA number and something else called an X waiver. Long story short, on December 29th, 2022, President Biden approved the elimination of the data X waiver requirement, meaning now any provider can prescribe buprenorphine, including Suboxone, without an X waiver. They just need to be registered with the DEA and meet any state-specific requirements. So basically, the waiver was waived. Here's the historical context. In the year 2000, the Drug Addiction Treatment Act, aka Data 2000, was passed, where the DEA required doctors to apply for this X waiver in order to prescribe medication for addiction treatment, like Suboxone. And it was called an X waiver because the license number began with an X. The goal of this law was to allow doctors to increase access to medications for opioid use disorder. Prior to the Data 2000 law, a doctor could only prescribe Suboxone to patients at federally certified opioid treatment programs, aka OTPs. So in effect, the Data 2000 law waived them from these OTP regulations and allowed them to prescribe buprenorphine to patients if they met certain requirements like holding a DEA registration number and completing an 8-hour training program. This 8-hour training program was supposed to increase awareness of opioid use disorder and increase doctors' ability to provide addiction treatment. But policy experts and activists have argued that X waiver just made it really hard for people in rural areas and people of color to access buprenorphine in the midst of the opioid crisis. Thankfully, on December 29, 2022, President Biden approved the elimination of the X waiver requirement, meaning any prescriber who has a DEA registration number can write for Suboxone.